Today's topic is anxiety and depression and how we can tackle this problem by making simple changes in our day to day life. So, we know that anxiety and depression is a growing problem, more so in young people. Almost everyone seems to have an element of anxiety or depression these days, or a combination of both. And the emphasis seems to be on using antidepressants. People feel that antidepressants will cure the problem, will treat the illness, and that is not true. They are hardcore medicines that come with plenty of side effects. A lot of side effects are severe in a lot of people, and they don't necessarily cure the problem. They just make your mood neutral. Now, I'm not disagreeing that they are not helpful. In some situations, antidepressants do help. But the focus of today's talk is that there are simple things in our lifestyle which directly affect hormone or chemical levels and directly enhance mood and well-being. And it's far more important to address these and work on these than starting medicines like antidepressants. So, anxiety, depression, or a combination of both is a set of symptoms where someone is feeling down, depressed, low in mood, feeling tired, lethargic without a reason, and losing concentration and not having pleasure in day to day things. Things that they would normally enjoy, that they seem to find no pleasure in it. And in severe situations, it's really sad. Patients find that they want to harm themselves, they want to end their lives. Now, as you can appreciate, it's a frustrating situation. It's an annoying situation, not just for the patient, but also for their carers and families. I want to explain to you, backed with scientific evidence, how things like smoking, alcohol, sleep, diet, exercise has a direct impact on chemicals and hormones in the brain that enhance mood. So, a widely accepted theory is that low levels of this chemical or hormone in the brain called serotonin cause depression or cause low mood. Let's start with smoking. We know that smoking, the nicotine in the smoking, temporarily, for a very short period of time, increases the levels of serotonin, and thereby you feel that relaxed, happy feeling. You become happy. But when we do that in the long run, it actually changes the chemical composition of the brain, and in the long run, smoking reduces serotonin and therefore reduces the happiness or makes you sad. Same as with alcohol. Temporarily, it gives you that sense of well-being or pleasantness, but over time, it actually makes you sad. And then there are issues, obviously, of withdrawal when a person becomes addicted to these things. Next is exercise. It's very important to understand that when we do exercise, when the heart rate goes beyond a certain level, when the blood pressure is high, and when you're doing it regularly, it directly tells the brain to release more and more serotonin, to release more and more of this happy chemical. So we know now how doing exercise can help treat your anxiety or depression. Next comes diet. Now, diet does not have a direct impact on the level of serotonin in the brain. However, if we eat healthily, plenty of fruit and vegetables, plenty of fiber, a lot of water to stay hydrated, no heavy, large, oil-based or sugary foods, all these factors mean that the body feels light. Digestive system doesn't have to work hard. You won't feel sluggish. Your bowels will be nice and regular. Your body will be cleansed. Kidneys will be working actively and efficiently because of that increased amount of water in the body. And all the toxins will be excreted from the body regularly, at a much more efficient pace. Now, that in essence means that you will feel light and your mind will be able to be focused on other things. You'll be able to concentrate on other things like meditation or relaxation or exercise. You won't feel heavy. And the last thing I want to stress upon is sleep. So as medics, we use the term sleep hygiene, which means a set of rules or some guidance which dictates what the kind of things we should do before we go to sleep in order to get a good night's sleep. And we all know how important sleep is. A good night's sleep means that you're relaxed the next day, you can function better, you feel lighter, you don't feel tired, lethargic, or low in mood. So, a couple of do's and don'ts when it comes to sleep is do not look at any screens before you go to bed. It's very easy to have your mobile phone next to you, have a lot of radiation next to you, and look at the screen or go on social media or check emails. It's a temptation. I appreciate that in today's busy world. But if we can try and avoid screens before bedtime, so leave 1 to 2 hours before your bedtime, no screens, no TV, no iPads, no mobile phones, and use that precious time to do something that's nice and relaxing for you. Whether it is listening to relaxing music, whether it's meditating, whether it's reading a book, whether it's doing a religious activity. But those 1 to 2 hours before you go to bed should be relaxing time for the brain, not highly intensive time where the brain has to work hard and be stimulated. And also very important is do not eat before bedtime. Eat plenty of hours well before your bedtime and make sure that you have a light meal so the digestive system is not on the go when you're sleeping and your body can properly rest. So guys, I hope you find this useful. The take-home message from today is that if you wholeheartedly and with good intention do these things, if you are somebody who is feeling low in mood for whatever reason, trust me, you will feel better by doing these simple things. And I'm not saying no to antidepressants, but the need for them can be avoided. We can reduce their use. In today's day and age, it seems like antidepressants are being used as jelly beans or sweeties almost, and people have become reliant on them. So today's video is just to emphasize the fact that simple actions in our day-to-day life can help you feel good.